Hello, the topic for today it's going to be attachments. With this small presentation, we are going to be able to review the different equipment that you might need and also the steps to place those attachments. But before we jump into the equipment, you must know that attachments are also known by engagers. These engagers will be made out of composite and we're going to be able to bond it directly to the tooth. What these attachments are going to do is that they're going to help in conjunction with the movements that are already built on the aligner to move the teeth. So we are going to place them in precise locations. Those locations are going to be indicated by full contour on your treatment summary. So let's jump into some of the equipment that you might need, which we're going to start first with the attachment template. This attachment template will be sent by full contour. It's going to have specific locations for your attachments to be placed. As well, we are going to need cheek retractor in order to complete all the processes of bonding material. In some cases, we might need petroleum jelly. As well, we're going to need our light cure lamp. As the doctor prefers, we're going to use packable or flowable composite. Also, the edge, it's going to be an important material. We are going to need some composite instruments as your choice. And in order to remove some of the material, we're going to need Arkansas stone burr and a little bit of pumice. Also, some of the other materials that we're going to require will be the adhesive, a high speed handpiece, and a low speed handpiece. Now, an important recommendation that some of the doctors have seen that works for placing the attachments is telling your patients not to wash their teeth with toothpaste before the attachment placement appointment, just because they have seen that in some moments these attachments may fall off because of the quantity of fluoride on the toothpaste. So let's jump quickly into some of the different steps that we are going to follow. First of all, we are going to go and polish. So this is why I place on the equipment that we might need the pumice. We are going to polish the teeth with pumice in order to prepare the tooth, prepare the surface for the attachment placement. As well, it's important to highlight that this is not a mandatory procedure. It's not a mandatory step. However, we've seen great results by just preparing the surface before placing the attachments. After we did this first step, it's important that we try on the template before putting any type of adhesive or etching. Go on, have those templates ready, identify the specific attachment locations, and of course, make sure that you have the cheek retractors that I mentioned before so we can isolate the entire teeth. As a second step, since we already have the specific locations, we are going to go in etch as the following manufacturer's instructions. That will depend on your different etch material. So we are only going to etch the area where the attachment is gonna be bonded. That's why it's so important that you find the specific spots. Please refrain from etching the whole facial area because we're not gonna need that. And make sure that when you end with leaving the etching as the manufacturer's instructions to rinse off all that acid with water, spray, suction, and if needed, cotton rolls. As for step 3, we are going to start filling in the template. This can be done by you or You can always have your assistant helping with placing the composite on the template. Just make sure that there's no excess. You can always manage the excess with the different instruments, and make sure as well that while you are jumping into step 4, to put away the template with the composite on where the light is not hitting that template, otherwise it will dry. So with step 4, which will be placing the bonding agent, we are going to place that bonding agent only in the edge area, and we're going to light cure every single spot. I'm not going to tell you in a specific time on how much this light cure has to go. Please follow your manufacturer's instructions according to the bonding agent that you bought. Now, we are going to go into what it's going to be the placement of the template. And we're going to place the template in the mouth. And this process is very customized. Every single treating doctor will decide how it's going to be easier for place that template. For example, in my experience, I have cut it the template in two, and I will place first one quadrant and then the other one. Some other doctors just prefer doing the entire quadrant at the same time, or even doing upper and lower at the same time. That is up to you and your different technique. After you place that template in the mouth, make sure that you apply a little bit of pressure and that you pack with your composite instrument all the different material. And as well, while you are curing the attachments with your lamp, make sure that you can add a little bit of pressure on that moment. Then, after you follow the light cure instructions, we are going to move forward with our step 6. In our step 6, we are going to remove the template. And we prefer, in this case, to use like a heavier sickle scaler rather than a dental splotter, even though this might tear the tray. But remember that you can always ask for a replacement if needed. So for our step number 7, we're gonna clear off the material with those Arkansas stone burrs that I mentioned at the very beginning. We're going to remove all the excess with that burr, making sure that we are not touching the attachment or changing the anatomy of the attachment. Otherwise, this is going to make changes on the different movements that we are about to perform. Also, I highly recommend the use of unwaxed dental floss just to check in that nothing of the material or maybe anything went into interproximal spaces. Now I want to go over the attachments guidelines that we have at full contour. This is going to be like a quick summary, but some instructions that we have inside full contour is that attachments must be placed prior making the staging process. Also, they might be around 2 millimeters thickness, and the position will be in the center of the tooth unless that attachment is colliding with any of the teeth adjacent or on the opposing arch. As well, these attachments should follow the angulation of the tooth, and the size will depend on the clinical crown. So, these are the two types of attachments that we are going to offer if you decide going with your clear aligners with full contour. We're going to have vertical attachments, which are going to help you for space closure, AP corrections, rotations, and tip movements. Also, we have the horizontal that it will help you with intrusion and extrusion movements. Now I'm going to show you some of the protocols that we have when these attachments are going to be triggered, when The designers will be placing them according to the movements and the amount of movement that we are going to have in our different cases. So as you can see on the first picture, we're going to have extrusion movement. This is how the attachment would look for, and the indication will be to be placed in the center of the tooth. As well, we're gonna have attachments for intrusion. As you can see, we're gonna place them on the anterior teeth if we have more than 1 millimeter on more than two teeth. And they are going to be placed, as you can see on the pictures, on both canines and first premolars. For rotation movements, as I mentioned before, vertical attachments in which we might have more than 28 degrees on the anterior teeth and more of 10 degrees on the posterior teeth. For space closure, or if we have a diastema, we are going to place these attachments on spaces greater than 1 millimeter on the two adjacent teeth of the space. So this is just a summary. Please keep in mind that we might need to change attachments of position if something is colliding or if the clinical crown is too small. These will be moments in which we might have to refrain of placing the attachment or changing the size. So this will be for today. Thank you for your attention, and let's change dentistry together.